What recommendations do you have for your patients over 60?
Well, first of all, 60 is young. I'm just saying that now that I'm fast approaching. So, it used to be when we were younger, it was all cardio. Cardio, we're running, we're ellipticaling, we're doing everything. Yeah, it's great, but sometimes those things done over years really impact your joints. And so as you get older, there's a lot of arthritic complaints that start to happen, a lot of noises that you make when you get up from sitting to standing and all those kinds of things. So now we really want to preserve muscle mass for you. And we do like the cardio, but it doesn't have to be high impact. So brisk walking, you have a focus, you're not sightseeing, you're really walking with a purpose, you're getting your heart rate up, you're keeping it up sustained. I always recommend starting on a level area, so if it's your neighborhood or anything like that, and then you slowly incorporate like hills, small hills, bigger hills. Some people like to hike, that's awesome too, you can do that. So that's good for cardio, and it has some muscle resistance in it, and it's great. It's a really good exercise, brisk walking, because it does engage the core, it keeps you upright, you've got fluid moving through all of the joints, so it's really good. In addition to that, muscle resistance is also very, very healthy. So you can do muscle resistance bands, you can do the low weights with repetition, you can do seated exercises. All of these things work to preserve muscle mass so that when you're going up and down stairs, you're not losing your balance. When you're trying to get up from a chair, you can actually do it. So if we could rewind time for some of our elderly patients, if they had started, doing things consistently in their 50s and 60s, and then just made it part of the norm for their overall health, probably they would be in a much better physical state with regard to muscle and arthralgias and movement and tolerance. So that's what it doesn't have to be complicated. I think people make it way too complicated. Brisk walking extended and muscle resistance activities, we shoot for about 150 minutes weekly. So if you wanted to do 5 sessions, 30 minutes, if you wanted to, reduce the sessions but elongate the time, absolutely, and build to it. We're not diving in. You're going to talk to your provider first to make sure that you can do these things, and then you just build to that. You don't have to start from that. So you start 1 day a week, 2 days a week, and then you slowly build up. That's all. That's really, I know it sounds like it's very simple, but finding the time to do it and the motivation to do it is also part of, the problem. So try to find time for you. It's really important. That's it. Just stay active.